This is a patient education review about the diabetes complication, and one of it is diabetic retinopathy. So, what is diabetic retinopathy? And what are the symptoms of diabetic retinopathy? Is there a test for the diabetic retinopathy? How is diabetic retinopathy treated? Can diabetic retinopathy be prevented? And when should I call the doctor? These are certain questions which need to be answered. So, what is diabetic retinopathy? This is an eye problem that can lead to the vision loss and even blindness. Having blood sugar levels that are above the goal increases the risk of retinopathy. What are the symptoms of diabetic retinopathy? Most people have no symptoms during the early stages of the disease. This is when the treatment works the best. For this reason, it is important to get screened for the condition early. This way, you and your doctors can take steps to protect your eye before your vision is damaged. When symptoms start, they can include blurry vision, dark or floating spots, trouble seeing things that are at the center of your focus when reading or driving, trouble telling colors apart. Is there a test for diabetic retinopathy? Yes, there are two main tests to check by the diabetic retinopathy: dilated eye exam. The eye doctor give you eye drops to make your pupils wider, and the drop make it easier for the doctor to see the different parts of the inside of your eye. Then the doctor looks at the back of your eye called the retina, and that's the part that is damaged by the diabetic retinopathy. Digital retinal examination or imaging. A technician takes picture of your eye with a special camera. They send the pictures to an eye doctor who checks for disease. It is okay to use the test if your first eye test have all been normal. Otherwise, you should have a dilated eye exam. If either tests show a problem, then the eye doctor might suggest other tests too. People with diabetes should have their eyes checked regularly. If you have retinopathy, you need to get checked at least once a year, maybe more. If not, you might only need to get checked every 2 years. Your doctor will work with you to decide on a schedule. If you have type 1 diabetes, eye exam should start 3 to 5 years after diagnosis. If you have type 2 diabetes, the eye exam should start right after diagnosis. How is diabetic retinopathy treated? Keeping your blood sugar and blood pressure level in goal range can help prevent diabetic retinopathy from getting worse. Other treatments can include photocoagulation. This is a laser surgery to see or destroy leaking and growing blood vessels in the retina. Vitrectomy. This is a surgery to remove blood from the part of the eye called the vitreous humor. And the doctors do this if the blood vessel in the retina leak into the vitreous humor. Medicines are certain medications that are injected into the vitreous humor are sometimes used alone and along with other treatments. Your eye doctor will let you know if medicines might help you. Can diabetic retinopathy be prevented? Yes. If you have diabetes, you can reduce your chance of getting diabetic retinopathy by keeping your blood sugar and blood pressure levels as close to your goal as possible. It might also be important to keep cholesterol levels in the normal range. When should I call the doctor? If you notice any changes in your vision, tell your doctor right away. And people with diabetes, not all vision changes are caused by the retinopathy. Vision loss or dark spots in your vision are signs that you should see an eye doctor as soon as possible. Thanks.